Thank you. I'm Dennis Low. I'm from the Center for Novostics. So Novostics stands for Novel Diagnostics. And we study human blood plasma, which contains a mixture of DNA from different parts of the body. And so by looking into plasma, it will basically provide us with a non-invasive window into our health. And human pregnancy is one such window is a release of DNA from the baby into the bloodstream. And from this, we have actually developed a new platform called non-invasive prenatal testing, which is now used worldwide, which has over 99% accuracy in the detection of Down syndrome, and which benefit over 10 million pregnant women every year. And for this work, I was fortunate to have received the Breakthrough Prize in 2021 and the Lasker DeBakey Award in 2022. So for this InnoHK project, we would like to further extend the use of this technology for NIPT and also to open other windows, especially for the detection of cancer. And we start with looking at nasopharyngeal cancer, or NPC for short, which is a cancer which is common in the southern part of China. And we use NPC because it's associated with Epstein-Barr virus infection. So we think that we can use the EBV DNA as a tumor marker. So we conducted a large-scale trial in Hong Kong on over 20,000 subjects. And we showed that by using our technology, we're able to actually detect this cancer early. And because of early detection, we can treat them early and resulting in a 10 times reduction in mortality. But however, we find that our test has some false positive results. And now it's individuals who are test positive, but who somehow do not have cancer at that juncture. And we wonder why. So through the use of InnoHK funding, we decided to actually study the 20,000 subjects again. And interestingly, we find that individuals without false positive, the chance of them having this cancer 4 years later, let's say, is 1 times. But if they have 1 false positive, then the risk will increase to 4.4 times. If it is 2 false positive, then the risk increases to a dramatic 16.8 times. So basically, by using this data, we can know how to risk stratify the individual and how frequently to do the test. And because of this, we actually started a company called Take-Two, because I believe I want to give people a second chance of health, and we now have a test called a prophecy test. And Take-Two have now raised a total of $35 million US, in which 10 million was raised in 2023. But however, NPC is only our first step. We like to actually extend this technology into other cancer types. And we start by looking at genetic alterations in cancer, like mutations. But however, we find those mutations is quite far and few in between, maybe 1 in a million. So it's not very robust. We're trying to screen for unknown cancer. So we moved from genetics into epigenetics, which is in which the DNA sequence remain unchanged, but we have some modification of that sequence with changes. And by using this epigenetic approach, we have developed one blood test which can test for multiple types of cancer. And also, we can even tell them where this cancer is. So this technology has been licensed to Grail, in which I'm a scientific co-founder, and Grail just launched a test called Gallery, which can test for 50 different types of cancer. And actually, it's been picked up by Time magazine as one of the top inventions last year. But however, the Grail test is quite expensive. It's about $950 US per test. So recently, we want to develop something cheaper. And when you look at DNA inside cells, it's a long thread of some 2 meters long. But in the blood, the DNA is fragmented into millions of pieces. And people have thought that this fragmentation is random. But we show that it's not. And not only is it not random, but it's actually related to the epigenetic status of the person, like the cancer. So we developed a technology called Fragma, which basically is about 5 times cheaper than existing technology because we don't need to do any conversion step. It's more rapid, which is versatile because it can work on blood and urine and can work in multiple cancer types like liver cancer, lung cancer, urinary tract cancer, etc. And because of this, we have founded a company called Insighter, and this year we have actually raised $100 million US for this, commercializing this. So through the use of the InnoHK platform, we are on a very good trajectory, and which I'm confident that we can build systems which can benefit healthcare worldwide. So thank you very much for your time.